Okay, Kevin, tell me a little bit about your speech.
We're supposed to talk about alcoholism, but that's the thing. Alcoholism is discouraged. It's a discouraged word according to the World Health Organization because it's not a good term to describe this kind of people. So let's get into this information because there's a disagreement of the definition of the word alcoholism is not recognized diagnosis, and the use of the term alcoholism is discouraged due to this heavily stigmatized connotation. You will know that the people who are called alcoholism, they assume that has strong and stigmatized connotation. So it's difficult for them to use that term. So that's why in medicine, there are a new classification for that term as alcohol use disorder in the DSM-5 or alcohol dependence in the ICD-11. That term changed in 1979, according to the World Health Organization, I was. And the term of the alcoholism due is inexact meaning, preferring alcohol dependence syndrome. So that's why in the book that we talk says only alcohol use disorder. The assessment. The patient should be considered as having alcohol problem if he or she answered yes to any of the CAGE questions. CAGE question is a questionnaire that are used as an acronym with could, down, annoyed, guilty, and eye-opener. The CAGE questionnaire is named is for the first question is one such an example that may be used to screen patients. It's a quickly tool for a doctor's office. Two yes response indicates that the respondent should be investigated further or be referred to the specialist. So the questionnaire asks the following question. Have you ever felt you need to cut down on your drinking? Have your people annoyed you by criticizing your drinking? Have you ever felt guilty about drinking? Or have you ever felt you need to drink first thing in the morning to steady your nerves or to get rid of hangover? According to this, these four questions are used to screen the patients if they have an actual alcohol use disorder. It's a simple way to diagnose this kind of disease. As we can see in the picture, who is a man drinking from a bottle of liquor while sitting on the boardwalk. That is a thing that we want to highlight because the people used to stigmatize the kind of people. That's why the term changed into alcoholism to alcohol use disorder. Because if you imagine some people drinking alcohol, you will think like this a picture. But instead of that, people who are alcohol use disorder or has that, they're no longer like that. They live like us. So it's different. Okay, medical evaluation investigation. What kind of tests we had to run on the patients? We had to run liver function tests to figure out what happened in the liver, complete blood count, to see if their microcysts may be present, who is which is the large cells in the blood, or electrolytes and renal function that can cause a reduce of magnesium, calcium, or potassium. That's why the people get dizzy or feel unestablished or feel vomiting, because all the things happen at the same time in the body. Okay, the management had to be individualized and may include the medics and also the thing that we discussed in the past class with a cognitive behavioral therapy. Okay, the thing is that there are a lot of maths, but are also simple few that we can use. For example, a caprosat that the mechanisms modulates glutamate. The glutamate is a receptor that is in your brain and establish or stabilize the brain in a hyperexcitability. So you can feel less stress or less uh, hyped up, and so you can feel a little bit more healthier using a compensate, because it reduces relapse rates of support abstinence or BT total. Naltrexone is also an antagonist receptor, but in this case, it's an opioid that blocks endorphin effects. The endorphins are neurosystems or things that help us to feel happier. But if you block that kind of receptor that make you feel happier, you feel bad drinking alcohol. That's why it is used. Reduce reward from alcohol effects, reducing cravings, reducing having a binge drinking, and reduce relapse. Okay, in other hand, we can also use the support, social support, and cognitive behavioral therapy help patients identify triggers for drinking, stress, social situation, emotional distress, recognize maladaptive thoughts such I need to drink to relax, that's not correct. Develop strategies and alternative behavior, like family and social support. The family group is where necessary, or peer-based programs like support groups, because it's quite tool to use share experience from individuals with similar struggles. So that's why it is a high support scenario, because we can share our experience with other people who has the same thing. Relapse prevention and strategies. According to this, we can have a high-risk situation because of stress, because the job, you feel loneliness. But the thing is to scope out that kind of triggers and reduce them and change your lifestyle modification, because you have to encourage the people in regular physical activity, structure daily routines to share with the people who you love more. Also, as physician or as a doctor, we can follow out and prognosticate this kind of patient. Monitoring relapse and adjust the treatment, because the thing is we had to adjust the treatment according to the patient, because every individual is different from another. So the goal is that we can help them to reduce the drinking to alcohol and also reduce the signs and symptoms that it can develop. So the thing is that we can use it as a big tool to share our experience with the patients and the families, and we can also not only help the patient, we can also help the families who are stick together. That is.
Excellent. A lot of information. It was really huge, all the information that you gave, and a big explanation. I have a lot of questions. The first one that I would like to know is, for example, if if I like to drink, to go parties, to be with our friends, and I have drinking habits, but not too much into it, how can I tell my warning signs to become alcoholic? That's what I want to say. How can I notice?
You can notice because, like we discussed, according to the case questionnaire, if you felt guilty about that, the thing is, if you feel guilty about drinking alcohol, it's because you are consuming a lot of alcohol. It's not only for a party.
Okay.
Or the people who are around you. If the people criticizing you by your drinking, it's a red flag, because if they are asking you that you should left alcohol because it's something wrong with you. Or if you need to drink on the morning, like a routine, it's not normal that you used to drink alcohol every day, because
Sure.
it's not water. You don't need to drink that.
Yeah, that's clear. Okay, now I have another question. I wrote a lot of questions. Okay, what role does genetic symptoms or the genetic problems, genetic in a person? I don't know if I got that. So, what role does genetic play in alcohol in the use result or disorder?
Generic symptoms, or what generic?
Yes, play in alcohol.
Okay, the
And how
generic.
can and how can it give me a disorder in my body? I know the problems because you told me, okay? But some of them is a use disorder. So the word is use disorder,
Use
basically.
disorder. Yes, there's a picture that describes quite good that.
Sure.
Okay, this is the most common symptom and effect of alcoholism. It can change so many things in your body, like in your brain, memory loss, dementia, causing dementia, bleeding esophageal varices, lungs, short of breathness. The main thing is on the liver, because it could cause cirrhosis or swelling on your liver. And in the stomach, ulcers, vomiting, caused by the vomiting. And it's a principal factor that can cause in long term heart stroke or another kind of disease with your heart. So the thing is, we have to be emphasize that the kind of problems can cause a lot of things in your body. So we have to reduce or encourage the people to reduce the drinking of alcohol, because there's so many of things that could happen in our bodies, and in addiction of alcohol.
Do you think that if a father was an alcoholic, do you think that that's going to pass from one generation to another? Do you think that is possible? That's why I call it like genetic problem.
Genetic. Yes. Around 20 or 30% could be genetic because we can transfer not only disease, we can transfer our desires, or we can transfer our skills, or the things that we love. And you can transfer to your children the love for your music or the love for I don't know, watch movies. But the thing is, if you grow up in a home that everybody drink alcohol and you seek the surrounding thing, it can cause or affect the children because they will be growing up thinking that is normal. That is not.
Yes, true.
So it can cause so many things, transferring your desires to the children's.
And my last question is how you, as a doctor, could recommend to a person that is deep in alcoholism, what is the first step that you would recommend to that person to cure, to have a help to reduce this alcoholism disorder?
Okay, the first thing you have to do not only because of your needs, you have to do it because your family needs to, your near ones. We cannot rely to these people we go to the chemist or the drugstore and buy some drugs. It's not the thing. We have to support them. I support the in this case the patient to reduce the binge or the impulses to drink alcohol. Instead of doing that, you can go outside and doing some exercise, go to the gym, socialize with some people, meet some new people who can reduce that kind of thing. If you move out to that, will help you in the future, not only for you, will help you with your grandparents and with your grandchildren, if you will be able to see them when they grow up someday.
Yes.
And the thing is, not only cause problem in the social, it also can cause problems in your body. So if you want to be healthier, you have to live that because it's not a good factor. It has a strong factors to cause heart attack problems, reduce your capacity of thinking and your capacity of work and all amount of things. So that is the thing.
Yes, it's true. The thing is, when people are into drugs or alcohol and depending on that, it's difficult for them to cure if they don't have a family around that can help them. So I think you mentioned the keyword, support. So the support of the family or a couple or maybe a friend or maybe somebody that can't help you to go and try to cure. Okay, I will go with you. So you will cure yourself of that. You will stop drinking alcohol, stop drugs and everything. But it's really hard for a person that is alone because doesn't have anybody to help. Of course, if they want to feel the self-impulse to cure themselves, okay, and go to the doctor, I guess doctors also have a big role here to recommend a person what to do. What is the first step? So that's why I told you what is the first step to take. And it's true, they have to do different activities that keep their mind and body busy and not to think about it. It's hard because it's kind of a depression, depending on the problems that they have. But I think this topic is amazing, Kevin. And you bring up all the keys and all the recommendations that people need in case they are submitted in alcoholism. So thank you so much. And it was amazing, really, as always. As always. Congrats. Okay, Kevin, that was excellent. I love it. I love it when you make a presentation because you give all the keywords necessary for the people to know exactly what is the problem and how we can attack the problem.